I'm going to continue talking about some more respiratory related conditions. Asthma is episodic, meaning it's experienced at irregular intervals and flares, so you might have an asthma attack. It's not a chronic condition. It results when the bronchioles are narrowed and there's an overproduction of thick mucus. These two things compromise airflow, mostly in one direction, so exhalation may be more forceful. Asthma is aggravated by stress, physical or emotional stress, and also by allergies. So allergies can prompt an asthma attack. You may be able to hear wheezing. So that's a respiratory sound that you should listen for. Pneumonia is caused by a virus, bacteria, or fungi in one or both lungs, and this causes inflammation. There are many signs and symptoms. You may hear crackles, lung sounds in one or both lungs. The patient may cough up mucus, have chest pain. Epiglottitis, which I cover in the respiratory video, is more common in adults than children, and this is due to childhood vaccines against it. A patient with this condition may be in tripod position, review what position that is, and they may be drooling. It is very important that you do not agitate the patient. So this may mean that you're not going to inspect the throat if it's going to agitate the patient. But you do want to administer high concentration oxygen, if possible, without agitating them. Croup is more common in children, about 6 months to 4 years old. And it's a viral infection that results in inflammation of the larynx, trachea, and bronchi. A child with this condition may have a loud cough, which is usually worse at nighttime. So the difference there between croup and epiglottitis, you can see what the patient's more like, what it's more common in. Cystic fibrosis is a genetic disease, usually presents in childhood, and it's characterized by thick, sticky mucus that accumulates in the lungs and digestive system. There are several signs and symptoms associated with it, including coughing up mucus, blood, fatigue, abdominal pain, and distension. Chronic obstructive pulmonary disease, COPD, can be caused by different conditions, most commonly caused by bronchitis or emphysema. And it triggers a hypoxic drive. So usually the brain signals when to breathe based on high levels of carbon dioxide in the blood. But COPD patients build up a tolerance to the high levels of carbon dioxide. So instead, their brain signals when to breathe based on low oxygen levels in the blood. This is called the hypoxic drive. So low oxygen levels in the blood trigger breathing. This can be a problem when you're ventilating a COPD patient because you may turn off that hypoxic drive. And the patient may respond to the higher oxygen levels by reducing their breathing. You need to be very cautious ventilating the patient. Still give oxygen regardless of the risk, but be mindful of the risks. Bronchitis is inflammation and mucus buildup in the bronchial tubes. Recall the bronchial tubes carry gases to and from the lungs. And gases are oxygen and carbon dioxide. And emphysema is caused by airflow limitations due to damaged alveoli. Recall, alveoli are the tiny air sacs at the end of the bronchial tubes. And that concludes this video on the rest of the respiratory conditions.